Welcome back to our discussion on bone health. I'm here with Dr. Marcy Goolsby and exercise physiologist Calissa Hall. In this section, we'll focus on how exercise, daily habits, and other lifestyle choices contribute to building and maintaining stronger bones. So, how can lifestyle factors like nutrition, physical activity, and sleep impact bone health?
Well, the lifestyle factors are part of that physiological function I was talking about earlier, building that foundation of posture and balance and mobility and strength and cardiovascular fitness. But another piece of that foundation is the lifestyle factors. Nutrition, we've kind of already touched on that quite a bit. That's going to play a huge role, again, making sure we're getting those vitamin D and calcium levels up and in the appropriate range, and then making sure we're getting the protein, making sure that we're able to build muscle using the strengthening exercises that we're trying to strategize with. Physical activity, we want strength training to be resistance. We want load bearing positions. We want weight bearing exercises that are going to be able to prepare us for more higher impact exercises, and those factors are going to be key in that foundation. We want to talk about sleep. Most people don't really think of sleep as being one of the major issues with bone health, but if we're not resting and recovering and we're doing all the other things correctly, but we're not allowing ourselves to reset and sleep and rest, then we're not going to be able to allow for our bones to remodel during that rest, because that's when it happens. And so we want to make sure that we are prioritizing our sleep, and stress management is a big part of that as well, because that's going to affect everything else that we do. And that lifestyle factor is going to be, again, one of the most important parts of that foundation.
So, regarding certain types of exercise, if someone's referred to you with low bone density and they want to improve their bone density, and they have very limited time to exercise, what exercises or things do you have them prioritize as far as the best exercises to support bone health?
Well, the first thing I'm going to do is I'm going to assess them and decide what their body needs the most. Because if I assign a bunch of exercises that they're going to do in this limited time and it's all going to impact their musculoskeletal system negatively, then we want to make sure that we're correcting that first. So we're going to assess their posture and their balance and their endurance and their strength, and those lifestyle factors. And then we're going to dive into what the strength training looks like. I want people to ask themselves, how hard is this exercise? Because a lot of people are doing little bouts of exercise, but they're not really challenging themselves. At the end of this 20-minute workout, if you ask yourselves, okay, rate that on a scale from 0 to 10, if you're rating that on a 3 or a 4, we're not really getting the kind of the impact that we want out of those exercises. And since we're limited on our time, we need to maximize that. So identifying your exertion and your work within exercise is going to be key. And then the exercises are easy from there. We're just making sure that these people are challenged, weight bearing exercises like squats and rows and presses and pull downs and walking and running and jogging. All of those provide the weight bearing challenge with the potential for adding external loads, which is what we're going to be aiming for. And then getting a little bit of that impact as well. If we're into our sports and into our recreational activities, we may be getting that already from that. But again, making sure we're supplementing that with the right muscle adaptation and goals is going to be key.
And I think it's important that you're meeting the patient where they're at. It should be an individualized program, and it doesn't need to be fancy, and it doesn't need to be something they have always hated to do. So I always ask the patients, like, what if they're not exercising, what have you done that you enjoyed? Are you I got to sign up for it. It's got to be a class. It's got to be on my calendar, or I'm not going to do it. Do you need to do it with somebody, like working with a trainer, somebody in performance staff? Is it a social thing for them? So that's where the classes and things like that. It doesn't need to be expensive. It doesn't need to be fancy. It doesn't need to be organized. And that's important for people to understand. Yet some people really need that in order for it to happen. So just understanding what the patient's goals are, what they've enjoyed doing previously that would be a reasonable thing for you to do, rather than just going in with your prescription pad and saying, this is what you need to do. Doing it together is really important.
Yeah, and that concept of like an exercise snack is something that I kind of promote as well for the people that don't have a lot of time. Even 5 and 10 minute bouts of exercise accumulate can make a difference. And so marching in place and push-ups on a kitchen counter may be all where we're at with while our coffee is brewing, and that's okay. And letting these people know that that's okay, and just kind of peppering it into the day is going to be key.
And I think that's really important in our current world where we sit a lot. We sit a lot. We're working at a computer. We're doing Zoom meetings, taking breaks in between those meetings and doing some squats or doing some lunges or doing something just to get up and get moving and find some benefit in that 30 seconds or 1 minute that you might
Absolutely.
have between meetings
Yeah,
is
absolutely.
I love the snack idea. Yeah.
Yeah. What about the sort of the other end of the spectrum, where we're talked about people who don't have a lot of time or they're mostly sedentary? What about like, you know, athletes or very active women who are following, really rigorous training programs? And how do, in that case, how do you balance the demands of training with supporting long-term bone health? Are there strategies for that?
Well, I mean, again, strength training, using what they're doing in their sport is going to be key because you're going to get a lot of that impact and that multi-directional exercise depending on the sport. But just also making sure that you're prioritizing the strength training and the impact training throughout the full year and not just during the season. You're taking that training and applying it to the rest of the year as well. And the off season is going to be key. And again, educating our coaches and our team members and making sure that we're all understanding the impact of the nutrition and that impact and how that's going to help their longevity and performance within their sport and also just in everyday life.
And one of the things that I sometimes see, in the patients that come in, let's say they've been training for a marathon, they come in with a stress fracture, is as the time demands of the running volume increase, a lot of times they drop the other things. So they may not prioritize their nutrition, they may not prioritize their sleep. And I find that to be a really critical component, and they may not drop their strength training and cross training. So if that happens, then we have that discussion of, okay, here's what happened with this plan. Next time you do this, how can we adjust so that this doesn't happen again? Because that's what they really want to know. They don't want it to happen again. They want to improve it.
And so, what role does recovery play in kind of long-term musculoskeletal health?
Well, our training causes stress, right? So it's a stressful situation for our bodies. So during the recovery is when we adapt and recover from that stress. So the recovery is really part of the training. So we want to make sure that we're allowing our bodies to recover and adapt. That muscle adaptation and that bone remodeling happens during recovery. So we want to make sure that we're allowing that. It also promotes being able to progress load. If you do a heavy workout on a Monday and then you go right into Tuesday and try to repeat that heavy load workout and don't give yourself that recovery or that rest, you're going to be at risk for injury. So we want to make sure that we allow ourselves to recover, and then we're going to build on that progression from that initial load-bearing exercise from Monday. So it's important to make sure that we're recovering, and just like we said, sleep is key.
hmm And that, not to get too sciency, but there's so many little metabolic things, the symphony of all of our hormones and iron and things like that that are affected by the exercise. So that recovery time is really critical. And the good coaches will know that. They'll know the importance of the right kind of training and building in the periodization and the rest and recovery time is really critical.